Hello, friends. Today we are going to discuss two cases which lead to same diagnosis by the same causative agent. Let us start. So, first case, a patient develops fever 12 days after getting a chemotherapy. On examination, he displays erythema and soreness at the IV catheter insertion site. Blood cultures have come back positive. The patient's original catheter is withdrawn and vancomycin is administered. Okay. Second case, a chronic renal failure necessitated the placement of catheter for dialysis in a patient. Tenderness and soreness around a peritoneal catheter are reported. Gram positive, catalase positive, coagulase negative cocci are found in the blood cultures, opting over several days. The catheter was withdrawn and antibiotics were started. So what is common between these two cases is that there is a catheter insertion is there, and later on patient develops illness, basically erythema and soreness at catheter site, and blood cultures are positive, and gram positive, catalase positive, coagulase negative cocci is found. So it is basically the foreign body infection by coagulase negative staphylococcus. Now, infection of foreign body or indwelling medical devices or equipment that are implanted in the body. For example, prosthetic valve, prosthetic joints, catheters, IV lines. They're very common by Coagulase negative staphylococci, mostly Staphylococcus epidermidis, which is the most common cause among all Coagulase negative staphylococci. Neutropenic patients are most vulnerable, and infection can lead to bacteremia or sepsis. So, what is the pathogenesis? Bacterial flora of skin, which is basically staphylococci. They have polysaccharide or capsule or slime layer of bacteria, which allows them to adhere to these medical devices. And these indwelling medical devices, they inoculate bacteria into internal site. And then bacteria colonize and cause inflammation at the device site. So, what are the investigations that we could do in this case? So, either we can take that indwelling medical device and culture that, or we can perform blood culture, which is much easier to do. But skin flora often contaminates blood culture, so resulting false positive blood culture, mainly by Staphylococcus epidermidis. So that has to be kept in mind. Gram-positive cocci in clusters, which are catalase positive, that establishes that it is staphylococci, and coagulase test is negative, which says that it is coagulase negative staphylococcus. Now, two common coagulase negative staphylococci which are medically important is Staphylococcus epidermidis and another one which causes UTI, that is Staphylococcus saprophyticus. So for that, we do a no biosine susceptibility test. If it is no biosine susceptible or sensitive, it is Staphylococcus epidermidis. And if it is resistant, it is Staphylococcus saprophyticus. There are other coagulase negative staphylococci also, which are emerging as a pathogen nowadays, like Staphylococcus intermedius, pseudo intermedius, higus, and so on. So, what could be the treatment? Treatment is obviously you can give an antibiotic, which is vancomycin, because most strains they are resistant to penicillin and cephalosporin in such cases. But important is that you remove the source of infection. So, foreign body removal is necessary. So, removal of foreign body with antibiotic, that is vancomycin, is